What are the clinical features of trigeminal neuralgia? So there are excruciating paroxysmal facial pain. Predominantly, it affects the maxillary division. Predominantly affects the maxillary division of the trigeminal nerve. So the lips, the gums, the cheeks, and the chins can be involved. Very rarely, the ophthalmic division is involved. So usually, if you have an ophthalmic division involvement, you'll have to work up for a possible trigeminal neuropathy rather than a neuralgia. So you have to see whether there's any underlying structural cause for the neuralgia or neuropathy. Usually, the paroxysm of pains lasts for a few seconds, and sometimes the patients may wince with pain. This is called a tic. That is why trigeminal neuralgia is also known as tic douloureux. And the classical feature of these pains is it is triggered by sensory triggers. So the patient washes their face, brushes their teeth, or the fan draft of air touches the face. These cutaneous triggers are very classical for a trigeminal neuralgia. As I mentioned, the bouts usually last for around weeks to months. However, they spontaneously remit. However, usually they tend to relapse over time. So as I mentioned, the cutaneous triggers can be because of washing the face, brushing the teeth, or exposure to a draft of air. Can even be triggered by even speaking, chewing, or even smiling. The usual trigger zones are over the face, lips, and the tongue. However, there is no objective sensory loss. So what does this mean? What does no objective sensory loss means? So when you have a trigeminal neuropathy, the patient will have an objective sensory loss. That means when you examine the facial sensations, the patient will say that there are decreased sensations on that particular side. But if you examine a patient with trigeminal neuralgia, they will have no facial sensory loss. Even though they might have cutaneous triggers and severe pain, they will not have negative sensory symptoms. That is numbness. So if a patient with trigeminal neuralgia has numbness or any negative sensory symptoms, it's actually you have to look for a trigeminal neuropathy. That is basically a secondary cause for a trigeminal nerve involvement. Maybe because of a demyelinating disorder or CP angle tumor, or you'll have to work it up. So remember that no objective sensory loss. If there is objective sensory loss, it is not a trigeminal neuralgia, rather it is a trigeminal neuropathy.